Let's talk about how to fix the adrenal body type. Okay, so are we talking about adrenal fatigue? Are we talking about some adrenal disease? Well, the medical profession doesn't acknowledge adrenal fatigue. They don't really think that it exists. And that's totally fine because what are they going to do? Just give you another drug, give you a steroid? I think if you have adrenal stress, adrenal burnout, adrenal fatigue, whatever you want to call it, I think you should use natural type remedies. So the first question is, where are the adrenals? Well, they're located right above the kidney, right on top of the kidneys. Okay, you have two of them, and they're little triangle glands, and they have an inside and an outside. The outside is called the cortex, adrenal cortex, and then the inside is called the medulla, the adrenal medulla. The main hormone that we're going to focus on the outside is called cortisol. And then the neurotransmitter on the inside that we're going to focus on is called adrenaline. And the entire adrenal system relates to something called fight or flight. And that relates to its purpose, which is to adapt the body to a stress state. Now, what does that mean, adapt the body to a stress state? Well, it's quite interesting that you have an entire system that adapts your body to this very interesting condition or state, which is during stress. Whether you're attacking something, fighting something, or you're running away from something, okay, you have a system to help you survive. So, what this system does through all of its different adaptations is to prepare your body to survive during a stress mode. And of course, this was designed to be more short term, not long term, like we experience nowadays with sustained chronic mental stress. Our bodies were designed to handle a bit more physical stress. So you need more blood flow to certain muscles. You need more heightened energy in your brain to focus in on certain things and solve certain problems relating to survival. You need quick energy, as in glucose energy, and you don't need energy to certain body systems like reproduction, like the immune system, like your digestion. So that's the function of the adrenals, and these hormones go through almost every cell in the body and start to change certain things to adapt the body to prepare for this stress situation. So, what's the significance of that? Well, if you're under chronic mental stress, okay, or you have major losses in your life, or you have surgeries or traumas, which, by the way, all these stresses accumulate over time. And then they create situations where the adrenals become dysfunctional to a certain degree. And I'm not even talking about a disease, I'm talking about like a subclinical problem with the adrenal. At first, have a higher level of these hormones, and then over time, you start developing like cortisol resistance, just like insulin resistance, where now the cortisol doesn't work, but you have high levels of cortisol and symptoms of low cortisol. It makes it really confusing. But let's go through the symptoms that someone might experience if they have adrenal fatigue or adrenal dysfunction. Number one, their tolerance for stress is lowered. They can't tolerate babysitting a room full of small children at a daycare center for more than 8 hours. They can't tolerate a slow driver in front of them for a period of, 2.5 hours where they're on the freeway. For some reason that bothers them. They definitely can't tolerate incompetent people or people that are considered more stupid or people that make maybe stupid decisions. They just have a low tolerance for that. Unless they're in an environment where everything is logical and perfect, they get impatient. They become irritable and they have sometimes even anxiety. And anxiety is like worry and an inability to decide on something because there's a chronic problem. The moment someone decides and solves the problem, the anxiety is less. Now, it can also affect excessive thinking, analyzing things, especially when you're trying to sleep. In the middle of the night, you're solving all these problems and just keep going and going and going. That's an adrenal symptom. And because the adrenals, the cortisol is another name for that is called glucocorticoid, you actually turn protein into glucose. So you're running your body on glucose. And that's something that your adrenals basically cause your liver to make more sugar to run on sugar fuel because it's quick energy. The problem is stress really equals sugar. And even though you're not eating sugar, you're getting a lot of sugar in the bloodstream. And that can cause blood sugar problems and even, believe it or not, diabetes. And what's happening with all the sugar is that it's going to be converted to cholesterol, not the friendly type. Also, you're getting conversion into fat on the liver, fat in the visceral organs right here, because that's a survival mechanism to hold fat in the midsection. In fact, in really extreme examples, I'll show you in this book right here, SIBA Collection of Medical Illustrations, Volume 4, Endocrine System. You can see this is an adrenal body type right here. You can see the person's holding fat right here, and then the body is extracting protein from the gluteus maximus and putting it right into that part right here, and then taking muscle from this extra muscle here called the quads, putting that right in that midsection right here. So there's all these physiological things that happen throughout the body, which I'm going to get into. Another thing that happens with the adrenal is they get hyperacidity, gastritis. And this is why some people can experience ulcers from stress, because the stress activates this acidity, which then burns a hole right through your stomach. The blood pressure goes up with adrenal, okay? You have increased pulse rate. You can have the symptom of asthma. And because you get cortisol resistance, cortisol is normally an anti inflammatory, but now you have the opposite of that, which is